Question 1. Performance analysis shows a divergence in proposed key performance indicators, KPI, for the upcoming quality improvement cycle, with the Chief Medical Officer prioritizing clinical outcome metrics, the Chief Nursing Officer focusing on patient care delivery efficiency, and the patient advocate emphasizing patient satisfaction scores. Which approach best ensures the development of comprehensive and effective KPIs aligned with healthcare quality standards? Option A. Adopt a set of universally recognized industry standard KPIs that are easily measurable and reportable, regardless of specific organizational context or stakeholder input. Option B. Allow each department head to independently select and track KPIs relevant to their area, with a consolidated report presented to leadership for review. Option C. Facilitate a cross-departmental working group, including patient representatives, to collaboratively define, prioritize, and validate KPIs that encompass clinical effectiveness, patient safety, patient experience, and operational efficiency, ensuring alignment with organizational quality goals and regulatory expectations. Option D. Implement the KPIs proposed by the Chief Medical Officer, as clinical outcomes are the primary determinant of healthcare quality and are typically the focus of regulatory reporting. The correct answer is C. Facilitate a cross-departmental working group, including patient representatives, to collaboratively define, prioritize, and validate KPIs that encompass clinical effectiveness, patient safety, patient experience, and operational efficiency, ensuring alignment with organizational quality goals and regulatory expectations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the perspectives of diverse stakeholders, each with their own priorities and understanding of healthcare quality. The Chief Medical Officer, CMO, is focused on clinical outcomes and physician performance. The Chief Nursing Officer, CNO, on patient care delivery and nursing staff efficiency, and the patient advocate on patient experience and access to care. Effectively integrating these viewpoints into a cohesive set of key performance indicators, KPI, is crucial for driving meaningful quality improvement without creating conflicting goals or overburdening specific departments. The challenge lies in ensuring that KPIs are not only measurable, but also relevant, actionable, and aligned with the overall strategic objectives of the healthcare organization, as mandated by regulatory bodies overseeing healthcare quality and patient safety. Correct approach analysis. The correct approach involves facilitating a collaborative session where representatives from all key stakeholder groups, clinical leadership, nursing leadership, patient advocacy, and potentially administrative/operations, work together to define and prioritize KPIs. This process ensures that KPIs reflect a holistic view of quality, encompassing clinical effectiveness, patient safety, patient experience, and operational efficiency. By engaging all stakeholders, the organization can achieve buy-in, foster a shared understanding of quality goals, and select KPIs that are truly indicative of high-quality care delivery. This aligns with regulatory expectations that healthcare organizations actively involve patients and their representatives in quality improvement initiatives and demonstrate a commitment to patient-centered care. The focus is on developing a balanced scorecard of KPIs that addresses multiple dimensions of quality, rather than prioritizing one stakeholder's perspective over others. Incorrect approaches analysis. One incorrect approach is to solely rely on the CMO's proposed KPIs, which may overemphasize clinical outcomes at the expense of patient experience or nursing workflow efficiency. This could lead to physician burnout or a neglect of crucial aspects of care delivery that are within the nursing domain, potentially violating ethical obligations to provide comprehensive care and regulatory requirements for patient satisfaction. Another incorrect approach is to prioritize KPIs that are easiest to measure or report, without considering their true impact on patient outcomes or stakeholder satisfaction. This can result in a set of vanity metrics that do not drive meaningful quality improvement and may not meet the rigorous standards set by healthcare quality oversight bodies. It fails to demonstrate a genuine commitment to improving care. A third incorrect approach is to adopt a one-size-fits-all set of KPIs, without tailoring them to the specific needs and context of different departments or patient populations. This can lead to irrelevant or unattainable targets for certain groups, causing frustration and undermining the overall quality improvement effort. It also fails to acknowledge the diverse needs of patients and the varied roles of healthcare professionals, which is a core tenet of patient-centered care and effective quality management. Professional reasoning. Professionals should approach KPI development by first understanding the organization's strategic quality goals and the specific regulatory requirements for quality reporting and improvement. Then they should identify all relevant stakeholders and their perspectives on what constitutes high-quality care. A structured, collaborative process for defining, selecting, and validating KPIs is essential. This process should involve 1. Identifying potential KPIs across all dimensions of quality clinical outcomes, patient safety, patient experience, efficiency. 2. Gathering input from all stakeholder groups to ensure relevance and buy-in. 3. Prioritizing KPIs based on their alignment with strategic goals, measurability, actionability, and impact on patient care. 4. Establishing clear definitions, data sources, and targets for each KPI. 5. Regularly reviewing and refining KPIs based on performance data and evolving organizational and regulatory landscapes. This systematic, inclusive, and data-driven approach ensures that KPIs are robust, meaningful, and effectively drive quality improvement in a manner that is compliant with professional standards and regulatory mandates. Question 2. The performance metrics show that our hospital's readmission rates for congestive heart failure patients are significantly higher than the national average and those of comparable institutions. A review of competitor data indicates that a leading hospital in a similar demographic region has achieved substantially lower readmission rates through a specific post-discharge patient education program. Which of the following approaches best aligns with regulatory expectations and professional best practices for addressing this quality gap? Option A. Conduct a thorough root cause analysis of our current CHF patient discharge process, including patient interviews, staff feedback, and a review of existing protocols, to identify specific areas for improvement before considering external best practices. Option B. Implement a new, unproven remote patient monitoring technology that a vendor claims can reduce readmissions based on their promotional materials. Option C. Immediately adopt the post-discharge patient education program implemented by the leading hospital, assuming their success is directly transferable to our patient population and operational structure. Option D. Focus all quality improvement efforts on achieving the national average readmission rate for CHF patients, without a detailed investigation into the underlying causes of our current performance. The correct answer is A. Conduct a thorough root cause analysis of our current CHF patient discharge process, including patient interviews, staff feedback, and a review of existing protocols, to identify specific areas for improvement before considering external best practices. Explanation. This scenario presents a common challenge in healthcare quality improvement: interpreting benchmarking data and deciding on the most effective strategy for improvement. The professional challenge lies in moving beyond simply identifying a performance gap to developing a sustainable and compliant improvement plan. Careful judgment is required to ensure that the chosen approach aligns with regulatory expectations for quality and patient safety, and that it is ethically sound. The correct approach represents best professional practice because it involves a systematic, data-driven investigation into the root causes of the performance disparity. This aligns with the principles of continuous quality improvement mandated by regulatory frameworks such as those overseen by CMS, Centers for Medicare and Medicaid Services, in the U.S., which emphasize evidence-based interventions in patient outcomes. By engaging stakeholders and reviewing existing protocols, the quality professional ensures that any proposed changes are practical, effective, and address the underlying issues rather than superficial symptoms. This proactive and analytical method is crucial for demonstrating a commitment to quality and compliance. An incorrect approach that focuses solely on adopting a competitor's best practice without understanding its applicability or underlying success factors would be professionally unacceptable. This fails to meet regulatory requirements for a thorough quality assessment and improvement process. It risks implementing ineffective or even detrimental changes, potentially leading to patient harm and non-compliance with quality standards. Ethically, it bypasses the due diligence required to ensure patient safety and optimal care. Another incorrect approach that involves implementing a new, unproven technology based on anecdotal evidence from a single source would also be a regulatory and ethical failure. Healthcare quality improvement must be evidence-based. Adopting unvalidated interventions can lead to unintended consequences, increased costs, and a failure to achieve desired outcomes, all of which are contrary to regulatory expectations for responsible quality management. This approach lacks the rigor required to demonstrate a commitment to patient well-being and efficient resource utilization. Finally, an approach that prioritizes achieving a specific benchmark score over understanding the patient care processes that contribute to that score is a superficial and potentially harmful strategy. Regulatory bodies are concerned with the quality of care delivered, not just the achievement of arbitrary targets. Focusing solely on the score can lead to teaching to the test, behaviors that do not translate to genuine improvements in patient outcomes or safety. This approach neglects the ethical imperative to provide the highest quality of care. The professional reasoning process for similar situations should involve 1. Acknowledging the performance gap identified through benchmarking. 2. Initiating a root cause analysis to understand the contributing factors. 3. Reviewing existing organizational policies, procedures, and resources. 4. Engaging relevant clinical and administrative staff to gather insights and foster buy-in. 5. Researching evidence-based interventions and best practices, considering their applicability to the specific organizational context. 6. Developing a targeted improvement plan with measurable objectives and timelines. 7. Implementing the plan, monitoring progress, and evaluating outcomes. 8. Sustaining improvements through ongoing review and adaptation. Question 3. Analysis of the implementation of an accountable care organization, ACO, model within a multi-state healthcare system reveals potential challenges in coordinating care across diverse patient populations and provider networks. Which of the following approaches best mitigates the inherent risks associated with this new delivery model? Option A. Delay formal risk assessment until the ACO has been operational for at least 1 year, allowing for the collection of real-world performance data to inform the assessment. Option B. Adopt risk mitigation strategies that have been successful in similar ACOs in different geographic regions without conducting a specific analysis of the current system's unique vulnerabilities. Option C. Prioritize securing the maximum available financial incentives for ACO participation, assuming that financial success will inherently address other operational challenges. Option D. Conduct a comprehensive risk assessment to identify, analyze, and develop mitigation strategies for potential operational, financial, and clinical risks before full implementation. The correct answer is D. Conduct a comprehensive risk assessment to identify, analyze, and develop mitigation strategies for potential operational, financial, and clinical risks before full implementation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare quality professional to assess the risk associated with implementing a new healthcare delivery model without a clear, established framework for risk mitigation. The inherent complexity of accountable care organizations, ACO, involves shared financial risk, coordinated care across multiple providers, and the need for robust data analytics, all of which present potential pitfalls if not managed proactively. The professional must balance the potential benefits of improved quality and cost efficiency against the risks of operational failure, financial instability, and compromised patient care. Correct approach analysis. The correct approach involves a comprehensive risk assessment that systematically identifies potential risks, analyzes their likelihood and impact, and develops mitigation strategies. This aligns with the principles of proactive quality management and risk aversion mandated by healthcare regulations aimed at ensuring patient safety and financial stewardship. Specifically, for ACOs, this would involve evaluating risks related to data integration, physician buy-in, patient engagement, and the ability to meet quality metrics. A thorough risk assessment allows for informed decision-making, resource allocation, and the development of contingency plans, thereby safeguarding the success of the ACO and protecting patient outcomes. This approach is best professional practice as it demonstrates due diligence and a commitment to quality improvement by anticipating and addressing potential problems before they negatively impact care delivery or financial viability. Incorrect approach is analysis, an approach that focuses solely on the potential financial incentives without a thorough risk assessment is professionally unacceptable. This represents a regulatory failure by neglecting the requirement to ensure the sustainability and quality of care provided within the ACO framework. Ethically, it prioritizes financial gain over patient well-being and operational integrity, an approach that delays risk assessment until after the ACO is fully operational is also professionally unacceptable. This constitutes a significant failure in quality management and risk mitigation. It violates the implicit regulatory expectation that new models of care are implemented with a robust understanding of potential challenges. Ethically, it exposes patients and providers to unnecessary risks and potential harm due to unforeseen operational or clinical issues. An approach that relies on anecdotal evidence or the experiences of other organizations without conducting a specific, tailored risk assessment for the current context is professionally unsound. This demonstrates a lack of rigorous analysis and a failure to adapt best practices to the unique circumstances of the organization. It risks overlooking critical, context-specific risks, leading to potential regulatory noncompliance and ethical breaches related to patient safety and resource management. Professional reasoning. Professionals should employ a structured risk management framework. This involves 1. Identifying all potential risks associated with the chosen healthcare delivery model, e.g., ACO, PCMH, considering operational, financial, clinical, and technological aspects. 2. Analyzing the likelihood and potential impact of each identified risk. 3. Prioritizing risks based on their severity. 4. Developing and implementing specific mitigation strategies for high-priority risks. And 5. Establishing a system for ongoing monitoring and review of risks and mitigation effectiveness. This systematic process ensures that decisions are evidence-based, compliant with regulatory expectation, and ethically sound, prioritizing patient safety and organizational success. Question 4. The control framework reveals that a healthcare organization is experiencing a persistent issue with medication reconciliation errors at patient discharge. To address this, the quality improvement team is considering several approaches to implement a new process. Which approach is most likely to lead to sustainable and effective improvement, aligning with best practices in healthcare quality management? Option A. Implement a phased rollout of the new medication reconciliation process, beginning with a pilot unit involving frontline staff in the design and testing, and establishing clear feedback mechanisms for ongoing refinement. Option B. Mandate the immediate organization-wide adoption of a highly structured, complex quality improvement methodology, requiring extensive training for all staff before any practical implementation begins. Option C. Focus solely on updating the electronic health record system to enforce the new medication reconciliation steps, assuming the technology alone will drive compliance and improvement. Option D. Rely exclusively on an external consulting firm to design and implement the new medication reconciliation process, with minimal involvement from internal clinical staff during the initial rollout. The correct answer is A. Implement a phased rollout of the new medication reconciliation process, beginning with a pilot unit involving frontline staff in the design and testing, and establishing clear feedback mechanisms for ongoing refinement. Explanation. This scenario presents a common challenge in healthcare quality improvement. The successful implementation of a chosen model requires more than just theoretical understanding. It demands practical adaptation to the unique organizational culture, existing processes, and staff engagement levels. The professional challenge lies in selecting and applying a quality improvement model that is not only evidence-based, but also feasible and sustainable within the specific context of the healthcare organization. Careful judgment is required to balance the rigor of a model with the realities of daily operations and human factors. The correct approach represents best professional practice because it acknowledges that a one-size-fits-all application of quality improvement models is rarely effective. By focusing on a phased implementation, starting with a pilot project and involving frontline staff early, this approach builds buy-in, allows for iterative refinement based on real-world feedback, and minimizes disruption. This aligns with the principles of continuous quality improvement, emphasizing learning and adaptation, which are implicitly supported by regulatory frameworks that mandate effective quality management systems and patient safety initiatives. The emphasis on data collection and feedback loops is crucial for demonstrating compliance with quality standards and for identifying areas for further improvement, as expected by regulatory bodies overseeing healthcare quality. An incorrect approach that solely focuses on rapid, organization-wide rollout without adequate preparation or staff engagement risks significant resistance and failure. This could lead to a breach of ethical obligations to provide safe and effective care, as poorly implemented changes can inadvertently introduce new risks. From a regulatory perspective, Such an approach might fail to demonstrate a robust quality management system, potentially leading to noncompliance with standards that require evidence of effective process control and staff competency. Another incorrect approach that prioritizes the theoretical purity of a model over practical application, such as rigidly adhering to Six Sigma's DMAIC phases without considering the organization's readiness or the specific nature of the quality problem, can lead to wasted resources and frustration. This failure to adapt the model to the context could be seen as a lack of due diligence in quality improvement efforts, potentially impacting patient outcomes and therefore raising regulatory concerns about the effectiveness of quality initiatives. A third incorrect approach that relies solely on external consultants without empowering internal staff to lead and sustain the improvement efforts undermines long-term success. While consultants can provide expertise, a lack of internal ownership and capacity building can result in a temporary fix rather than a sustainable change. This can be viewed as a failure to establish a culture of quality, which is often a key expectation in healthcare quality regulations. The professional decision-making process for similar situations should involve a thorough assessment of the organization's readiness for change, including its culture, resources, and existing infrastructure. It requires selecting a quality improvement model that best fits the identified problem and the organizational context, followed by a strategic implementation plan that includes stakeholder engagement, pilot testing, data-driven evaluation, and continuous refinement. Professionals must prioritize patient safety and regulatory compliance throughout the process, ensuring that all quality improvement activities are transparent, evidence-based, and contribute to the overall goal of enhancing healthcare quality. Question 5. The monitoring system demonstrates a statistically significant increase in patient falls over the last 3 months, with data indicating variations in frequency across different patient care units and shifts. Which of the following statistical tools would be most effective in guiding the initial phase of a quality improvement initiative aimed at reducing these falls by identifying the most impactful contributing factors? Option A. Utilizing a Pareto analysis to categorize and rank the common causes of patient falls, allowing for targeted intervention on the most frequent contributors. Option B. Implementing a simple scatter plot to explore potential correlations between patient falls and a single, randomly selected demographic variable. Option C. Employing a run chart to visually track the overall trend of patient falls over time, without further analysis of specific contributing factors. Option D. Conducting a basic frequency count of all reported patient falls, without stratifying by cause or location, to understand the overall volume. The correct answer is A. Utilizing a Pareto analysis to categorize and rank the common causes of patient falls, allowing for targeted intervention on the most frequent contributors. Explanation. The monitoring system demonstrates a pattern of patient falls that, while fluctuating, shows a concerning upward trend over the past quarter. This scenario is professionally challenging because it requires a healthcare quality professional to move beyond simply observing data to actively intervening and identifying root causes. The challenge lies in selecting the most appropriate statistical tool to guide this intervention, ensuring that the chosen method effectively supports evidence-based quality improvement initiatives within the regulatory framework of the Associate Professional in Healthcare Quality APHQ exam. The correct approach involves utilizing a Pareto analysis to identify the most frequent contributing factors to patient falls. This is best professional practice because it aligns with the APHQ emphasis on data-driven decision-making and efficient resource allocation. By focusing on the vital few causes that contribute to the majority of falls, the quality team can prioritize interventions that will yield the greatest impact, thereby improving patient safety and outcomes. This proactive, problem-solving approach is implicitly supported by quality improvement principles that are foundational to healthcare regulation, aiming to reduce preventable harm. An incorrect approach would be to solely rely on a run chart to track the trend of patient falls without further investigation into the underlying causes. While a run chart shows variation over time, it does not inherently identify root causes or prioritize areas for improvement. This failure to delve deeper into the data could lead to misdirected or ineffective quality improvement efforts, potentially violating ethical obligations to provide the highest standard of care and regulatory expectations for systematic quality management. Another incorrect approach would be to immediately implement a broad, unanalyzed set of interventions across all patient care units without first identifying specific contributing factors. This lacks the systematic, data-driven approach expected in healthcare quality. It represents a failure to apply appropriate statistical tools for problem identification and prioritization, potentially wasting resources and failing to address the most critical issues. This can be seen as a deviation from best practices in quality improvement and may not meet the standards of due diligence expected in healthcare settings. The professional reasoning process for similar situations should involve 1. Clearly defining the problem, e.g., increased patient falls. 2. Selecting appropriate statistical tools for data analysis based on the problem's nature, e.g., Pareto for cause identification, control charts for process stability. 3. Analyzing the data to identify root causes and patterns. 4. Prioritizing interventions based on the analysis. 5. Implementing and monitoring the effectiveness of interventions. 6. Documenting the process and outcomes for continuous improvement and regulatory compliance. Question 6. Research into the implementation of a new set of quality metrics for a healthcare organization reveals a significant challenge in selecting the most appropriate measures for patient safety and clinical effectiveness. The organization has a diverse range of clinical services and varying levels of data collection maturity across departments. Which of the following approaches would best align with the principles of effective quality measurement and regulatory compliance for healthcare quality professionals? Option A. Select metrics based on the availability of external benchmarks from similar organizations, without a deep analysis of their applicability to the specific patient population and service mix of the current organization. Option B. Conduct a thorough review of the organization's strategic quality objectives, assess the current data infrastructure and capabilities, and engage clinical leadership and frontline staff to collaboratively select a balanced set of valid, reliable, and actionable metrics that align with regulatory expectations. Option C. Focus on metrics that have been historically used by the organization, assuming they remain relevant and effective, to maintain consistency in reporting and minimize disruption to current processes. Option D. Prioritize metrics that are easily accessible through existing electronic health record (EHR) functionalities, even if they do not fully capture the desired quality outcomes, to ensure rapid implementation and reporting. The correct answer is D. Prioritize metrics that are easily accessible through existing electronic health record (EHR) functionalities, even if they do not fully capture the desired quality outcomes, to ensure rapid implementation and reporting. Explanation. This scenario presents a common implementation challenge in healthcare quality, specifically concerning the selection and application of quality metrics. The professional challenge lies in balancing the need for robust, evidence-based metrics with the practical realities of data availability, system capabilities, and stakeholder buy-in within a specific regulatory environment. The chosen metrics must not only reflect desired quality outcomes, but also be reliably and consistently measurable to support meaningful improvement efforts. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and collaborative method for metric selection. This involves understanding the organization's strategic goals, assessing current data infrastructure, and engaging relevant stakeholders to ensure buy-in and feasibility. Adhering to established quality frameworks and regulatory guidelines, such as those relevant to the APHQ exam jurisdiction, is paramount. This ensures that the chosen metrics are not only relevant, but also compliant and contribute to demonstrable improvements in patient care and organizational performance, aligning with the core principles of healthcare quality as defined by regulatory bodies. An incorrect approach that focuses solely on readily available data without considering its relevance to desired outcomes fails to meet the fundamental purpose of quality measurement. This can lead to the tracking of vanity metrics that do not drive meaningful improvement and may even mask underlying quality issues. Ethically, it is a failure to uphold the commitment to patient safety and quality care. Another incorrect approach that relies on anecdotal evidence or opinions rather than objective, quantifiable data is fundamentally flawed. Quality measurement requires objective data to identify trends, assess performance, and guide interventions. Relying on subjective information can lead to biased decision-making and ineffective quality improvement initiatives, potentially violating regulatory requirements for data-driven quality assessment. A third incorrect approach that ignores the organization's existing data infrastructure and technological capabilities can lead to the selection of metrics that are impossible to track accurately or efficiently. This results in wasted resources, frustration among staff, and unreliable data, undermining the entire quality improvement process and potentially leading to non-compliance with reporting requirements. A professional reasoning process for similar situations should involve a structured approach. 1. Define the quality goals and desired outcomes. 2. Identify potential metrics that align with these goals. 3. Assess the feasibility of data collection and the reliability of existing data sources. 4. Engage stakeholders to gather input and ensure buy-in. 5. Select metrics that are valid, reliable, actionable, and aligned with regulatory requirements. 6. Implement a robust data collection and reporting system. 7. Regularly review and refine metrics based on performance data and evolving organizational needs. Question 7. Stakeholder feedback indicates that communication breakdowns between nursing, physicians, and allied health professionals are leading to delays in care plan adjustments and increased patient readmissions. Which of the following approaches best addresses this interdisciplinary collaboration challenge within the U.S. regulatory framework for healthcare quality? Option A. Provide individual professional development courses for each discipline to enhance their specific communication skills. Option B. Implement a mandatory weekly interdisciplinary team meeting where each discipline presents patient updates, discusses challenges, and collaboratively refines care plans. Option C. Designate a lead physician to oversee and approve all interdisciplinary care plan modifications. Option D. Encourage team members to communicate patient concerns through informal channels as they arise throughout the day. The correct answer is B. Implement a mandatory weekly interdisciplinary team meeting where each discipline presents patient updates, discusses challenges, and collaboratively refines care plans. Explanation. This scenario presents a common challenge in healthcare quality, ensuring effective interdisciplinary collaboration when diverse professional perspectives and priorities exist. The challenge lies in balancing the need for timely patient care with the distinct roles, responsibilities, and communication styles of various healthcare professionals. Careful judgment is required to identify and implement strategies that foster mutual respect, shared understanding, and a unified approach to patient outcomes, all within the established regulatory framework for healthcare quality in the United States. The correct approach represents best professional practice because it directly addresses the identified communication breakdown by establishing a structured, regular forum for interdisciplinary dialogue. This aligns with the principles of patient-centered care and quality improvement mandated by U.S. healthcare regulations, such as those promoted by the Joint Commission and the Centers for Medicare and Medicaid Services, CMS. These bodies emphasize the importance of coordinated care and effective communication among all members of the healthcare team to ensure patient safety and optimal outcomes. A dedicated interdisciplinary meeting provides a platform for open discussion, problem-solving, and the development of shared care plans, thereby enhancing efficiency and reducing the risk of errors stemming from miscommunication or lack of awareness of other team members' contributions. An incorrect approach that focuses solely on individual professional retraining fails to address the systemic issue of interdisciplinary communication. While individual skill enhancement is valuable, it does not guarantee improved team dynamics or the establishment of a collaborative culture. This approach neglects the regulatory expectation for coordinated care and can lead to continued fragmentation of services, potentially violating quality standards that require a holistic approach to patient management. Another incorrect approach that involves empowering a single discipline to dictate care plans overlooks the fundamental principle of interdisciplinary collaboration. Healthcare quality is a shared responsibility, and imposing a hierarchical structure where one profession dominates decision-making undermines the expertise and contributions of other team members. This can lead to suboptimal care, patient dissatisfaction, and potential noncompliance with regulations that promote shared decision-making and respect for all healthcare professionals' roles. A third incorrect approach that relies on ad hoc, informal communication channels is insufficient for addressing systemic collaboration issues. While informal communication has its place, it lacks the structure and accountability necessary for consistent, effective interdisciplinary teamwork. This can result in missed information, delayed interventions, and a lack of clear documentation of collaborative efforts, all of which are detrimental to quality care and can lead to regulatory scrutiny. The professional decision-making process for similar situations should involve a systematic assessment of the root causes of collaboration challenges, drawing on stakeholder feedback. This assessment should then inform the selection of interventions that are evidence-based, aligned with regulatory requirements for coordinated care, and promote a culture of shared responsibility and mutual respect among all healthcare professionals. Prioritizing structured communication, clear role definition, and shared goal setting are key elements of effective interdisciplinary collaboration in U.S. healthcare. Question 8. Governance review demonstrates a significant increase in patient falls within a specific unit over the past quarter, with preliminary data suggesting a correlation with changes in staffing ratios and the introduction of new mobility equipment. The quality improvement team is tasked with addressing this trend to meet regulatory requirements for patient safety and maintain accreditation standards. Which of the following approaches best aligns with established healthcare quality frameworks and regulatory expectations for risk mitigation and continuous improvement? Option A. Immediately reassign staff from other units to the affected unit to restore previous staffing ratios, assuming this will resolve the issue, and postpone further investigation until the fall rate stabilizes. Option B. Focus solely on documenting each fall incident meticulously and reporting it through the incident reporting system, without initiating a proactive investigation or intervention strategy. Option C. Conduct a comprehensive root cause analysis to identify all contributing factors to the increase in patient falls, develop evidence-based interventions tailored to the identified causes, and implement a plan for ongoing monitoring and evaluation of fall rates and intervention effectiveness. Option D. Implement a mandatory, unit-wide training session on fall prevention techniques for all staff, without first analyzing the specific reasons for the recent increase or evaluating the effectiveness of existing training. The correct answer is C. Conduct a comprehensive root cause analysis to identify all contributing factors to the increase in patient falls, develop evidence-based interventions tailored to the identified causes, and implement a plan for ongoing monitoring and evaluation of fall rates and intervention effectiveness. Explanation. This scenario is professionally challenging because it requires balancing immediate operational needs with long-term strategic quality improvement goals, all while adhering to specific regulatory and accreditation standards. The healthcare organization is facing a critical situation that demands a swift response, but any action taken must be grounded in evidence-based practices and aligned with established quality frameworks to ensure patient safety and regulatory compliance. The pressure to resolve the immediate issue might tempt decision-makers to adopt shortcuts or less rigorous methods, which could have significant negative repercussions. The correct approach represents best professional practice because it prioritizes a systematic, data-driven risk assessment that directly addresses the identified quality gap. This aligns with the core principles of healthcare quality improvement and the mandates of accrediting bodies like the Joint Commission or NCQA, which emphasize proactive identification, analysis, and mitigation of risks to patient care. By focusing on root cause analysis and developing targeted interventions, the organization demonstrates a commitment to sustainable improvement rather than superficial fixes. This approach ensures that resources are allocated effectively to address the most critical issues, and that interventions are evidence-based and likely to yield positive, measurable outcomes, thereby meeting regulatory expectations for continuous quality improvement. An incorrect approach that focuses solely on immediate symptom management without understanding the underlying causes would be professionally unacceptable. This fails to address the root of the problem, leading to recurring issues and a lack of genuine improvement, which is a direct violation of accreditation standards that require systemic problem solving. Another incorrect approach that involves implementing a solution without proper validation or data collection would be a failure to adhere to evidence-based practice principles, a cornerstone of quality healthcare and a requirement for accreditation. This approach risks introducing new, unforeseen problems or wasting valuable resources on ineffective interventions. Finally, an approach that bypasses established governance or quality improvement processes to expedite a solution, even with good intentions, undermines the integrity of the quality management system and can lead to inconsistent application of standards, a significant regulatory and ethical failure. The professional reasoning process for similar situations should involve a structured approach. First, clearly define the problem and its potential impact on patient care and organizational compliance. Second, engage relevant stakeholders, including quality improvement professionals, clinical staff, and leadership, to gather diverse perspectives. Third, conduct a thorough risk assessment, utilizing tools like root cause analysis to identify underlying factors. Fourth, develop evidence-based, measurable interventions that are aligned with regulatory and accreditation requirements. Fifth, implement the interventions with clear accountability and monitor their effectiveness through robust data collection and analysis. Finally, communicate findings and outcomes transparently to all relevant parties and use the learnings to inform future quality initiatives. Question 9. Which approach would be most effective and compliant in addressing a recurring pattern of medication errors identified through incident reporting and patient outcome data? Option A. Procure and implement a new electronic medication administration system without further analysis of current workflow issues. Option B. Conduct a comprehensive root cause analysis to identify systemic factors contributing to the medication errors and develop targeted interventions based on the findings. Option C. Focus disciplinary actions on individual nurses identified as having made medication errors. Option D. Immediately implement a mandatory, one-time training session for all nursing staff on medication administration protocols. The correct answer is B. Conduct a comprehensive root cause analysis to identify systemic factors contributing to the medication errors and develop targeted interventions based on the findings. Explanation. This scenario presents a common challenge in healthcare quality, balancing immediate patient safety concerns with the need for systematic, evidence-based improvement. The professional challenge lies in identifying the most effective and compliant method to address a recurring adverse event, ensuring that interventions are not only responsive, but also sustainable and aligned with regulatory expectations for patient safety and risk management. Careful judgment is required to avoid reactive measures that may not address root causes or to implement changes without proper validation. The correct approach represents best professional practice because it prioritizes a thorough, data-driven investigation to understand the underlying systemic issues contributing to the adverse events. This aligns with the principles of continuous quality improvement and the regulatory framework for patient safety, which mandates proactive identification, analysis, and mitigation of risks. By conducting a root cause analysis, RCA, healthcare organizations can move beyond superficial fixes to implement targeted interventions that address the fundamental causes of errors, thereby preventing recurrence and improving overall patient outcomes. This systematic approach is often a requirement or strong recommendation within healthcare quality standards and regulatory guidelines focused on patient safety. Implementing a rapid, ad hoc training session without a clear understanding of the root cause is professionally unacceptable because it is unlikely to be effective in preventing future incidents. It represents a failure to adhere to best practices in risk management, which emphasize analysis before intervention. This approach risks wasting resources and may create a false sense of security without addressing the actual problem. Focusing solely on individual staff performance without investigating systemic factors is also professionally unacceptable. This approach can lead to a culture of blame rather than a culture of safety, which is counterproductive to quality improvement. It fails to acknowledge that most adverse events are the result of system failures, not solely individual errors. Regulatory bodies and quality frameworks strongly advocate for system-level analysis and improvement. Implementing a new technology solution without a thorough assessment of its suitability and integration into existing workflows is professionally unacceptable. While technology can be a valuable tool, its implementation must be guided by a clear understanding of the problem it is intended to solve and its potential impact on patient care and staff. This approach risks introducing new risks or failing to achieve the desired safety improvements. The professional reasoning process for similar situations should involve a structured approach to problem solving. First, clearly define the problem and its scope. Second, gather data to understand the frequency, severity, and context of the adverse events. Third, conduct a root cause analysis to identify underlying systemic factors. Fourth, develop evidence-based interventions to address the identified root causes. Fifth, implement and monitor the effectiveness of these interventions, making adjustments as necessary. This iterative process ensures that quality improvement efforts are targeted, effective, and compliant with regulatory requirements. Question 10. The review process indicates that a hospital has recently implemented a new electronic health record (AIR) system aimed at improving care coordination and reducing medication errors. To assess the impact of this technology on healthcare quality, which of the following approaches would be most aligned with the principles of healthcare quality management and regulatory expectations for demonstrating effectiveness? Option A. Measure the system's uptime and the speed at which patient data can be accessed, assuming these technical metrics directly translate to improved quality of care. Option B. Rely primarily on feedback from physicians and nurses regarding their perceived ease of use and satisfaction with the new EHR system. Option C. Focus the evaluation on the cost savings achieved through reduced paper usage and administrative overhead associated with the EHR implementation. Option D. Conduct a comprehensive analysis of pre- and post-implementation data on key quality indicators such as medication reconciliation rates, adverse drug event reporting, and patient readmission rates, correlating these with the EHR's functionalities. The correct answer is D. Conduct a comprehensive analysis of pre- and post-implementation data on key quality indicators such as medication reconciliation rates, adverse drug event reporting, and patient readmission rates, correlating these with the EHR's functionalities. Explanation. The scenario presents a common challenge in healthcare quality, evaluating the impact of a new technology on patient outcomes and operational efficiency. The professional challenge lies in moving beyond anecdotal evidence or initial implementation enthusiasm to a rigorous, data-driven assessment that aligns with established quality frameworks and regulatory expectations. This requires a nuanced understanding of how technology adoption intersects with patient safety, data integrity, and resource allocation, all of which are central to the associate professional in healthcare quality APHQ domain. Careful judgment is needed to distinguish between superficial improvements and genuine, sustainable quality enhancements. The correct approach represents best professional practice because it mandates a systematic and evidence-based evaluation. This aligns with the core principles of healthcare quality management, which emphasize continuous improvement through measurement, analysis, and intervention. Specifically, it reflects the APHQ focus on utilizing data to drive decisions and ensure that technological investments demonstrably contribute to improved patient care, reduced errors, and enhanced patient experience, all within the purview of relevant U.S. healthcare regulations and quality standards. This approach prioritizes objective assessment over subjective impressions, ensuring accountability and transparency in quality initiatives. Each incorrect approach represents specific regulatory or ethical failures. One incorrect approach fails by relying solely on user satisfaction surveys. This is ethically problematic as it prioritizes perceived ease of use over actual clinical impact and patient safety, potentially overlooking critical quality deficits that users may not recognize or report. It also fails to meet regulatory requirements for demonstrating quality improvement through objective metrics. Another incorrect approach, focusing only on cost savings, is ethically flawed because it risks compromising patient care or safety if cost reduction comes at the expense of necessary resources or interventions. This approach neglects the primary ethical obligation to patient well-being and may violate regulations mandating quality of care. A third incorrect approach, concentrating solely on the technical functionality of the technology, is insufficient because it fails to connect the technology's features to tangible improvements in healthcare quality outcomes. This overlooks the regulatory imperative to demonstrate value and effectiveness in patient care and can lead to misallocation of resources. Professionals should employ a decision-making framework that begins with clearly defining the quality objectives the technology is intended to address. This should be followed by identifying relevant measurable quality indicators, both clinical and operational, that can be objectively assessed. Data collection methods should be robust and designed to capture pre- and post-implementation performance. Analysis should then compare these metrics, considering potential confounding factors. Finally, the findings should be used to inform decisions about the technology's continued use, modification, or expansion, always with patient safety and regulatory compliance as paramount considerations. Question 11. The analysis reveals a significant increase in hospital-acquired infections, high, within a specific unit, prompting a quality improvement initiative to reduce these occurrences. The team needs to collect data to understand the root causes and monitor the effectiveness of interventions. Considering the associate professional in healthcare quality, APHQ. Exams focus on U.S. regulatory frameworks and best practices. Which data collection method would be most appropriate to initiate this investigation and subsequent monitoring? Option A. Conducting a broad survey of all hospital staff regarding their general perceptions of infection control compliance. Option B. A combination of direct observation of staff practices, review of infection control protocols, and analysis of patient medical records for documentation of infection prevention measures and HAI development. Option C. Implementing a new, complex electronic surveillance system for HAIs without first understanding current manual data collection processes. Option D. Relying solely on retrospective analysis of historical HAI rates without investigating current practices. The correct answer is B. A combination of direct observation of staff practices, review of infection control protocols, and analysis of patient medical records for documentation of infection prevention measures and HAI development. Explanation. This scenario is professionally challenging because it requires a healthcare quality professional to select the most appropriate data collection method for a specific quality improvement initiative, balancing the need for comprehensive data with practical constraints. The choice of method directly impacts the validity and reliability of the findings, which in turn influences the effectiveness of any subsequent quality improvement interventions. Careful judgment is required to ensure the chosen method aligns with the initiative's goals, the available resources, and the regulatory expectations for healthcare quality data. The correct approach represents best professional practice because it prioritizes a method that is both feasible and likely to yield actionable insights for the stated quality improvement goal. This aligns with the principles of evidence-based quality improvement, which necessitate the collection of relevant and reliable data to identify areas for improvement and measure the impact of interventions. Regulatory frameworks for healthcare quality, such as those overseen by CMS in the U.S., emphasize the importance of data-driven decision-making to ensure patient safety and improve health outcomes. Selecting a method that directly addresses the identified gap in care, while considering patient experience and clinical outcomes, is crucial for meeting these regulatory expectations and achieving meaningful quality improvements. An incorrect approach that relies solely on retrospective chart review might fail to capture real-time patient experiences or the nuances of care delivery that contribute to the identified issue. This could lead to incomplete data and potentially flawed conclusions, violating the ethical imperative to thoroughly investigate quality concerns. Another incorrect approach that focuses only on patient satisfaction surveys might overlook critical clinical process deviations or outcome data, thus not providing a holistic view of quality. This would be a failure to adhere to comprehensive data collection standards expected in healthcare quality. A third incorrect approach that proposes a complex, resource-intensive data collection method without clear justification for its necessity would be professionally unsound, as it wastes valuable resources and may not yield proportionally better results, potentially hindering the timely implementation of improvements. Professionals should use a decision-making framework that begins with clearly defining the quality improvement objective. Next, they should identify the specific data needed to measure progress towards that objective. Then, they should evaluate various data collection methods based on their ability to gather the required data, their feasibility in terms of time, cost, and personnel, and their alignment with regulatory and ethical standards. Finally, the chosen method should be piloted and refined as necessary to ensure its effectiveness and efficiency. Question 12. Governance review demonstrates a situation where a medication was prescribed incorrectly due to a transcription error, but the dispensing pharmacist identified the error and corrected it before the medication was administered to the patient, thus preventing any harm. Based on established healthcare quality principles, how should this event be classified, and what is the most appropriate next step? Option A. Classify the event as an adverse event and immediately escalate for a full root cause analysis due to the potential for harm. Option B. Classify the event as a near miss and initiate the organizational process for reporting and analyzing near misses to prevent future adverse events. Option C. Classify the event as a near miss but deem no further action necessary as no harm occurred. Option D. Classify the event as an adverse event and focus the investigation solely on the prescribing physician's error. The correct answer is B. Classify the event as a near miss and initiate the organizational process for reporting and analyzing near misses to prevent future adverse events. Explanation. Scenario analysis. This scenario is professionally challenging because it requires distinguishing between an adverse event and a near miss, both of which have significant implications for patient safety and organizational learning. The challenge lies in applying the correct definitions and understanding the distinct reporting and follow-up requirements mandated by healthcare quality frameworks. Misclassification can lead to missed opportunities for improvement or unnecessary alarm, impacting resource allocation and staff morale. Correct approach analysis. The correct approach involves accurately classifying the event based on established definitions. An adverse event is an unintended injury to a patient caused by medical management, not by the underlying disease process. A near miss, conversely, is an event that could have caused harm but did not, either by chance, timely intervention, or limitation of the harm. The correct approach, therefore, is to categorize the event as a near miss because the patient did not sustain harm, and then to initiate the established organizational process for reporting and analyzing near misses to prevent future adverse events. This aligns with quality improvement principles that emphasize learning from all safety events, regardless of outcome, to proactively enhance patient care. Incorrect approach is analysis. Classifying the event as an adverse event is incorrect because it misrepresents the outcome. While the potential for harm existed, the patient did not experience an unintended injury. This misclassification could lead to an overestimation of actual harm experienced by patients, potentially skewing quality metrics and triggering unnecessary investigations or interventions that do not reflect the true impact on patient safety. It fails to acknowledge the fortunate outcome and the opportunity to learn from a preventable situation without the burden of actual harm. Failing to report the event entirely is a significant regulatory and ethical failure. Healthcare quality frameworks universally mandate the reporting of all safety events, including near misses, to facilitate a culture of safety and continuous improvement. Not reporting a near miss means the organization loses a valuable learning opportunity to identify systemic vulnerabilities that, if left unaddressed, could lead to future adverse events. This inaction undermines the principles of proactive risk management and patient safety. Focusing solely on the staff member's actions without considering the systemic factors that contributed to the near miss is also an incorrect approach. While individual performance is relevant, a robust quality framework emphasizes a systems-based approach to incident analysis. Blaming individuals without investigating the underlying processes, equipment, or environmental factors that allowed the near miss to occur prevents the identification of root causes and the implementation of effective, sustainable solutions. This approach can foster a culture of fear rather than a culture of learning and improvement. Professional reasoning. Professionals should approach such situations by first understanding and applying the precise definitions of adverse events and near misses as outlined in their organization's policies and relevant quality standards. The decision-making process should involve 1. Gathering all relevant facts about the event. 2. Applying the definitions to accurately classify the event. 3. Following the established organizational protocols for reporting and investigating the classified event. 4. Focusing on system-level analysis to identify contributing factors and opportunities for improvement, rather than solely on individual blame. 5. Ensuring that lessons learned are disseminated and integrated into practice to prevent recurrence. Question 13. Market research demonstrates that improving patient experience is a key strategic priority for healthcare organizations. A quality improvement team is tasked with selecting and implementing a new system for measuring patient satisfaction. Considering the need for reliable data, efficient resource utilization, and minimal disruption to patient care, which of the following approaches is the most professionally sound for implementing a new patient satisfaction metric? Option A. Conduct a pilot program with a validated patient experience survey tool in a selected department to assess its effectiveness and feasibility before organization-wide implementation. Option B. Rely primarily on informal feedback gathered from frontline staff during daily patient interactions to assess overall patient satisfaction levels. Option C. Immediately deploy a newly developed, comprehensive patient satisfaction survey to all departments and patient populations to gather the broadest possible dataset from the outset. Option D. Prioritize the collection and analysis of publicly reported patient satisfaction scores as the primary indicator of organizational performance, with minimal internal data collection. The correct answer is A. Conduct a pilot program with a validated patient experience survey tool in a selected department to assess its effectiveness and feasibility before organization-wide implementation. Explanation. Scenario analysis. This scenario presents a common implementation challenge in healthcare quality, specifically concerning patient experience and satisfaction metrics. Challenge lies in balancing the need for comprehensive data collection with the practical realities of resource allocation, staff burden, and the potential for survey fatigue among patients. A healthcare organization aiming to improve patient experience must select a method that is both effective in gathering meaningful insights and sustainable within its operational constraints. The pressure to demonstrate improvement to stakeholders, including regulatory bodies and the public, adds another layer of complexity, requiring a strategic and evidence-based approach to metric selection and implementation. Correct approach analysis. The correct approach involves a phased implementation of a validated patient experience survey tool, starting with a pilot program in a specific department. This method represents best professional practice because it allows for the systematic evaluation of the survey's effectiveness, reliability, and impact on staff workflow before a full-scale rollout. It aligns with quality improvement principles of iterative testing and refinement. By piloting, the organization can identify and address potential issues, such as survey clarity, response rates, data collection logistics, and staff training needs, in a controlled environment. This proactive approach minimizes disruption, optimizes resource utilization, and ensures that the chosen metrics are truly reflective of patient experiences and actionable for improvement. Furthermore, using a validated tool ensures that the data collected is comparable to industry benchmarks and meets the expectations of quality oversight bodies, such as those referenced in U.S. healthcare regulations that emphasize patient-centered care and data-driven quality improvement. Incorrect approaches analysis. Implementing a broad, organization-wide rollout of a newly developed, unvalidated survey without pilot testing is professionally unacceptable. This approach risks collecting unreliable or irrelevant data, leading to misinformed quality improvement initiatives. It also places an undue burden on staff and patients, potentially causing survey fatigue and reducing overall engagement, which is a failure in ethical patient care and resource management. Focusing solely on publicly reported satisfaction scores without understanding the underlying patient feedback is also professionally unsound. Public scores are often aggregated and may not capture the nuanced details required for targeted improvements. This approach fails to meet the ethical obligation to actively seek and respond to patient concerns, and can lead to a superficial understanding of patient experience, neglecting opportunities for genuine service enhancement. Relying exclusively on staff anecdotal feedback to gauge patient satisfaction, while valuable as a supplementary source, is insufficient as a primary metric. Anecdotal feedback can be subjective, biased, and may not represent the broader patient population's experience. This approach lacks the systematic rigor required for objective quality assessment and fails to meet the standards for data collection expected by regulatory bodies focused on objective quality measurement. Professional reasoning. Professionals in healthcare quality must adopt a systematic and evidence-based approach to selecting and implementing patient experience metrics. The decision-making process should involve 1. Defining clear quality improvement goals related to patient experience. 2. Researching and selecting validated survey instruments that align with these goals and are appropriate for the patient population. 3. Considering the practical implications of implementation, including staff capacity, patient accessibility, and data management systems. 4. Employing a phased implementation strategy, such as piloting, to test and refine the chosen method before full-scale deployment. 5. Establishing mechanisms for ongoing data analysis, feedback integration, and continuous improvement. 6. Ensuring compliance with relevant regulatory requirements for data collection and reporting, prioritizing patient privacy and ethical considerations throughout the process. Question 14. During the evaluation of a hospital's patient fall reduction program, a quality improvement team is considering how to best involve frontline healthcare professionals in identifying and implementing further enhancements. Which of the following approaches would be most effective in fostering sustainable quality improvement and ensuring buy-in from physicians, nurses, and allied health professionals? Option A. Establish a multidisciplinary task force comprising frontline staff from various departments to brainstorm potential causes of falls, analyze existing data, and propose evidence-based interventions, with administrative support for implementation. Option B. Encourage individual healthcare professionals to report any observed fall risks, but defer any significant changes to the established quality improvement department without direct frontline staff involvement in the solution design. Option C. Focus on providing advanced statistical training to a select group of quality improvement specialists to analyze fall data and develop complex intervention strategies independently. Option D. Issue a directive from hospital administration outlining new protocols for patient mobility and requiring all staff to strictly adhere to them, with regular audits to ensure compliance. The correct answer is A. Establish a multidisciplinary task force comprising frontline staff from various departments to brainstorm potential causes of falls, analyze existing data, and propose evidence-based interventions, with administrative support for implementation. Explanation: this scenario is professionally challenging because it requires balancing the immediate needs of patient care with the long-term strategic goals of quality improvement, all while navigating the diverse perspectives and potential resistance of various healthcare professionals. Effective quality improvement necessitates buy-in and active participation from all levels of the healthcare team. The correct approach represents best professional practice because it acknowledges the critical role of frontline healthcare professionals in identifying and implementing quality improvements. By actively engaging physicians, nurses, and allied health professionals in the quality improvement process, their expertise and direct patient experience are leveraged. This aligns with the principles of patient-centered care and evidence-based practice, which are foundational to healthcare quality. Furthermore, fostering a culture of shared responsibility for quality improvement, as advocated by regulatory bodies like the Centers for Medicare and Medicaid Services, CMS, in the U.S., empowers staff, leading to more sustainable and impactful changes. This approach respects professional autonomy while promoting collaborative problem-solving, a hallmark of effective healthcare quality initiatives. An incorrect approach that focuses solely on administrative directives without involving frontline staff fails to recognize the practical realities of care delivery. This can lead to superficial changes that do not address root causes, alienate staff, and ultimately hinder genuine quality improvement. Ethically, it can be seen as a failure to respect the professional judgment and contributions of those directly involved in patient care. Another incorrect approach that prioritizes individual professional convenience over established quality protocols undermines the systematic nature of quality improvement. This can lead to inconsistencies in care, increased risk of errors, and a breakdown in the standardized processes designed to ensure patient safety and optimal outcomes. This approach violates the ethical obligation to provide safe and effective care and disregards the regulatory imperative to adhere to established quality standards. A third incorrect approach that dismisses feedback from frontline staff due to perceived lack of formal quality improvement training overlooks the invaluable insights gained from daily practice. Quality improvement is not solely the domain of trained specialists. It requires the collective intelligence of the entire healthcare team. Ignoring this feedback is a missed opportunity for identifying critical issues and can foster an environment where staff feel unheard and undervalued, thus impeding the progress of quality initiatives. This represents an ethical failure to foster a culture of continuous learning and improvement. The professional reasoning process for similar situations should involve a multi-stakeholder approach. First, identify the quality issue and its potential impact. Second, engage relevant frontline professionals to understand their perspectives, challenges, and potential solutions. Third, collaborate to develop evidence-based interventions that are practical and sustainable within the existing workflow. Fourth, implement the changes with clear communication and provide necessary training and support. Finally, continuously monitor the impact of the changes and make adjustments as needed, fostering a cycle of ongoing quality improvement. Question 15. Benchmark analysis indicates a healthcare quality professional has observed a pattern of serious medication errors affecting a specific patient population within their facility. While investigating, the professional identifies a particular patient whose case clearly exemplifies the systemic issue. The professional believes reporting this specific patient's detailed case to an external regulatory body is crucial to prompt immediate corrective action. However, the professional is aware that this detailed information constitutes protected health information, FI, under HIPAA. What is the most appropriate course of action for the quality professional? Option A. Ignore the quality issue to avoid any potential HIPAA violation, as patient privacy is paramount and any risk of disclosure must be eliminated. Option B. De-identify the patient's information independently and submit the report to the external regulatory body without consulting internal privacy or legal experts. Option C. Consult with the organization's privacy officer and legal counsel to determine the appropriate compliant method for reporting the quality issue, which may involve de-identifying patient information or seeking patient authorization. Option D. Directly report the detailed case of the identified patient, including all PHI, to the external regulatory body to ensure the urgency of the quality issue is understood. The correct answer is C. Consult with the organization's privacy officer and legal counsel to determine the appropriate compliant method for reporting the quality issue, which may involve de-identifying patient information or seeking patient authorization. Explanation. This scenario presents a professional challenge due to the inherent tension between a healthcare provider's duty to protect patient privacy and the need to ensure the quality and safety of care. The provider is caught between potentially violating HIPAA regulations by disclosing protected health information, FI, without proper authorization, and the ethical imperative to address a serious quality concern that could impact patient well-being. Careful judgment is required to navigate these competing obligations. The correct approach represents best professional practice because it prioritizes patient safety while adhering to regulatory requirements. By seeking guidance from the organization's privacy officer and legal counsel, the quality professional ensures that any action taken is compliant with HIPAA. This process allows for a thorough review of the situation, exploring permissible disclosures or de-identification of information if necessary, and establishing a secure and authorized pathway to address the quality issue. This upholds both the spirit and letter of HIPAA, protecting patient rights while facilitating necessary quality improvement. An incorrect approach that involves directly reporting the observed quality issue to the external agency without first consulting internal privacy and legal experts is a significant regulatory and ethical failure. This action would likely constitute a breach of HIPAA by disclosing PHI without a valid authorization or a specific exception. It bypasses the organization's established protocols for handling such matters, potentially leading to legal repercussions and damage to patient trust. Another incorrect approach, which is to ignore the quality issue to avoid any potential HIPAA violation, is also professionally unacceptable. While it might seem like a way to avoid regulatory scrutiny, it fails the fundamental ethical obligation to ensure patient safety and quality of care. This inaction could lead to continued harm to patients, and the quality professional would be failing in their core responsibilities, potentially facing professional sanctions for negligence. A third incorrect approach, which is to de-identify the patient information and report it without any internal consultation, carries its own risks. While de-identification is a mechanism to protect privacy, improper de-identification can still inadvertently lead to re-identification, especially when combined with other publicly available information. Furthermore, it bypasses the organizational process for assessing the necessity and appropriateness of such a report, potentially missing opportunities for internal resolution or more effective external reporting strategies. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the core issue. Is it a quality concern, a privacy concern, or both? 2. Consult internal resources. Immediately engage with the privacy officer, legal counsel, and relevant compliance departments. 3. Understand regulatory obligations. Clearly define the requirements of HIPAA and any other applicable regulations. 4. Explore permissible actions. Determine if there are any HIPAA exceptions that allow for disclosure or if de-identification is appropriate and feasible. 5. Document all steps. Maintain a clear record of the problem, consultations, decisions made, and actions taken. 6. Prioritize patient safety and privacy. Strive for a solution that balances these two critical aspects. Question 16. Process analysis reveals a significant bottleneck in the patient discharge process, leading to extended wait times and patient dissatisfaction. Which of the following strategies would be the most appropriate for addressing this issue within the framework of healthcare quality improvement? Option A. Focusing solely on reducing the number of required forms without assessing the impact on patient safety documentation. Option B. Immediately reassigning administrative staff to expedite paperwork, assuming this will resolve the delays. Option C. Relying on anecdotal feedback from nursing staff to make ad hoc adjustments to the discharge checklist. Option D. Implementing a multidisciplinary team to map the current discharge workflow, identify root causes of delays, and collaboratively design and test optimized workflows. The correct answer is D. Implementing a multidisciplinary team to map the current discharge workflow, identify root causes of delays, and collaboratively design and test optimized workflows. Explanation: this scenario is professionally challenging because it requires a healthcare quality professional to move beyond simply identifying a problem to strategically selecting the most effective and compliant method for improvement. The core challenge lies in balancing the need for efficiency with the imperative to adhere to established quality improvement frameworks and regulatory expectations within the Associate Professional in Healthcare Quality APHQ scope. Careful judgment is required to ensure the chosen approach not only addresses the identified inefficiency, but also aligns with the principles of evidence-based practice and patient safety, as mandated by healthcare quality standards. The correct approach represents best professional practice because it directly applies a recognized and structured methodology for process optimization, which is a cornerstone of healthcare quality improvement. This systematic approach, often involving detailed mapping, root cause analysis, and stakeholder engagement, ensures that improvements are data-driven, sustainable, and address the underlying issues rather than superficial symptoms. This aligns with the APHQ emphasis on applying quality improvement tools and techniques to enhance patient care and operational efficiency, adhering to principles of continuous improvement and evidence-based decision-making. An incorrect approach that focuses solely on immediate cost reduction without a comprehensive analysis of patient impact or workflow disruption would represent a regulatory and ethical failure. Such an approach could violate patient safety standards by inadvertently creating new risks or compromising care delivery. Another incorrect approach that bypasses established quality improvement protocols and relies on anecdotal evidence or individual opinions would fail to meet the rigor expected in healthcare quality, potentially leading to ineffective or even harmful interventions. This disregards the ethical obligation to implement changes based on sound evidence and established best practices, as expected within the APHQ framework. Professionals should employ a decision-making process that begins with a thorough understanding of the identified process inefficiency and its potential impact on patient outcomes and operational effectiveness. This should be followed by an evaluation of various quality improvement methodologies, considering their suitability for the specific problem, the availability of data, and the regulatory environment. The chosen approach must be justifiable based on established quality principles and evidence, and its implementation should be monitored for effectiveness and patient safety. Question 17. Regulatory review indicates that a recent initiative to reduce hospital-acquired infections, HAI, has shown a statistically significant decrease in reported HAI rates over the past 6 months. As the Associate Professional in Healthcare Quality APHQ, what is the most appropriate approach to reporting the impact of this initiative? Option A. Focus the report on qualitative feedback from frontline staff regarding their perception of the initiative's effectiveness, as this provides valuable insights into implementation challenges. Option B. Present a detailed analysis of all data points collected during the initiative's timeframe, regardless of their direct correlation to HAI reduction, to provide a complete data picture. Option C. Report only the statistically significant decrease in HAI rates, as this is the primary objective metric and demonstrates the initiative's success. Option D. Conduct a comprehensive impact assessment that analyzes the observed reduction in HAI rates in conjunction with changes in patient outcomes, length of stay, and associated costs, while also considering potential confounding factors and the specific interventions implemented. The correct answer is D. Conduct a comprehensive impact assessment that analyzes the observed reduction in HAI rates in conjunction with changes in patient outcomes, length of stay, and associated costs, while also considering potential confounding factors and the specific interventions implemented. Explanation: this scenario is professionally challenging because it requires a healthcare quality professional to interpret complex data trends and report findings in a way that is both accurate and actionable, while adhering strictly to the Associate Professional in Healthcare Quality (APHQ) regulatory framework. The challenge lies in moving beyond simple data presentation to a nuanced impact assessment that informs strategic quality improvement initiatives. The professional must balance the need for comprehensive reporting with the practical limitations of data collection and interpretation, ensuring that the reported impact is a realistic reflection of the quality initiatives. The correct approach represents best professional practice because it focuses on a comprehensive impact assessment that considers multiple dimensions of quality improvement. This involves not only identifying trends, but also analyzing the root causes of those trends and their downstream effects on patient outcomes, operational efficiency, and cost-effectiveness. This aligns with APHQ principles that emphasize data-driven decision-making and the holistic evaluation of quality initiatives. By linking observed data changes to specific quality interventions and considering potential confounding factors, this approach provides a robust foundation for future quality improvement efforts and demonstrates accountability. An incorrect approach that focuses solely on reporting the most statistically significant positive changes fails to provide a complete picture of the initiative's impact. This is a regulatory failure because it can lead to a misallocation of resources and a false sense of accomplishment, potentially masking underlying issues or areas where improvement is still needed. Ethically, it is a failure to be transparent and to provide a balanced assessment of performance. Another incorrect approach that prioritizes reporting only easily quantifiable metrics overlooks the qualitative aspects of healthcare quality, such as patient satisfaction or staff morale, which are crucial for a comprehensive impact assessment. This is a regulatory failure as it limits the scope of evaluation and may not fully capture the intended benefits of the quality initiative. Ethically, it fails to acknowledge the multifaceted nature of quality care. A third incorrect approach that focuses on reporting trends without attributing them to specific quality initiatives or considering external factors is also problematic. This is a regulatory failure because it hinders the ability to learn from the initiative and replicate successes or address failures. It also fails to demonstrate the value and effectiveness of the quality improvement efforts, which is a core responsibility of a healthcare quality professional. The professional reasoning process for similar situations should involve a systematic approach. First, clearly define the objectives and scope of the quality initiative being evaluated. Second, identify all relevant data sources and metrics, both quantitative and qualitative. Third, analyze the data to identify trends and patterns, considering potential confounding variables. Fourth, attribute observed changes to the quality initiative where possible while acknowledging limitations. Fifth, assess the impact across multiple domains of quality e.g., safety, effectiveness, patient-centeredness, timeliness, efficiency, equity. Finally, report findings in a clear, concise, and actionable manner, providing context and recommendations for future improvement. Question 18. Quality control measures reveal a recurring pattern of medication errors related to dosage calculation discrepancies across multiple patient care units. The quality improvement team is tasked with addressing this issue, considering the perspectives of pharmacists, nurses, physicians, and patients. Which analytical approach would be most effective in identifying the fundamental reasons for these errors and developing sustainable preventative strategies? Option A. Conduct a root cause analysis (RCA) to systematically investigate the underlying system failures that contribute to the dosage calculation discrepancies, involving all relevant stakeholders in the process. Option B. Gather feedback only from the pharmacy department regarding their dispensing practices to identify the source of the discrepancies. Option C. Implement immediate retraining for all nursing staff on medication calculation, without further investigation into the systemic factors. Option D. Focus solely on updating the electronic health record (EHR) systems medication ordering interface to prevent future input errors, without analyzing the current workflow. The correct answer is A. Conduct a root cause analysis (RCA) to systematically investigate the underlying system failures that contribute to the dosage calculation discrepancies, involving all relevant stakeholders in the process. Explanation: this scenario presents a professional challenge because it requires a healthcare quality professional to move beyond simply identifying a problem to understanding its systemic causes and potential future failures. The challenge lies in selecting the most appropriate analytical tool to address the specific nature of the quality issue, considering the perspectives of various stakeholders involved in patient care. Careful judgment is required to ensure the chosen methodology leads to effective and sustainable improvements, aligning with regulatory expectations for patient safety and quality of care. The correct approach represents best professional practice because it leverages root cause analysis, RCA, to deeply investigate the underlying systemic issues that led to the observed quality control findings. RCA is mandated or strongly recommended by regulatory bodies like CMS, Centers for Medicare and Medicaid Services, and is a cornerstone of quality improvement initiatives in U.S. healthcare. It focuses on identifying the why behind an event, leading to the development of targeted interventions that prevent recurrence. This aligns with the ethical imperative to provide safe and effective patient care and the regulatory requirement to implement robust quality assurance programs. An incorrect approach that focuses solely on immediate corrective actions without investigating underlying causes fails to address the systemic vulnerabilities. This is a regulatory failure because it does not meet the spirit or letter of quality improvement mandates that require proactive and preventative measures. Ethically, it risks patient safety by not preventing future occurrences of similar events. Another incorrect approach that only considers the perspective of a single department or stakeholder group is also professionally unacceptable. This is a regulatory failure as it can lead to incomplete analysis and solutions that do not account for the interconnectedness of healthcare processes. Ethically, it neglects the broader impact on patient care and the responsibilities of all involved parties. A third incorrect approach that relies on anecdotal evidence or superficial observations lacks the rigor required for effective quality improvement. This is a regulatory failure because it does not provide the data-driven evidence necessary for informed decision-making and may not identify the true root causes. Ethically, it can lead to misallocation of resources and ineffective interventions, potentially compromising patient safety. The professional decision-making process for similar situations should involve 1. Clearly defining the quality issue and its impact. 2. Identifying all relevant stakeholders whose perspectives are crucial for a comprehensive understanding. 3. Evaluating the nature of the problem to determine if it's a single event requiring RCA or a potential for future failures best addressed by FME. 4. Selecting the analytical tool that best fits the problem's complexity and the desired outcome, prevention vs. correction. 5. Ensuring the chosen methodology is aligned with regulatory requirements and ethical obligations for patient safety and quality. Question 19. Governance review demonstrates a strong organizational commitment to enhancing primary care services and improving patient outcomes. The leadership team is considering adopting a patient-centered medical home (PCMH) model to achieve these goals. What is the most appropriate next step for the quality improvement team to ensure successful and compliant implementation? Option A. Conduct a comprehensive assessment of the PCMH model's alignment with current quality improvement mandates, patient safety standards, and relevant regulatory requirements, while also evaluating its potential impact on patient experience and resource utilization. Option B. Focus on adopting the technological infrastructure associated with PCMH models, such as electronic health records with patient portals, without a full evaluation of the model's broader care coordination and team-based care components. Option C. Prioritize the adoption of the PCMH model based on its perceived potential for significant cost reductions, assuming quality improvements will naturally follow. Option D. Implement the PCMH model immediately across all primary care practices, relying on external consultants to manage compliance and operational adjustments. The correct answer is A. Conduct a comprehensive assessment of the PCMH model's alignment with current quality improvement mandates, patient safety standards, and relevant regulatory requirements, while also evaluating its potential impact on patient experience and resource utilization. Explanation: this scenario is professionally challenging because it requires balancing the strategic goals of adopting a new healthcare delivery model with the practical realities of regulatory compliance and operational effectiveness within the Associate Professional in Healthcare Quality (APHQ) framework. The decision-maker must consider not only the theoretical benefits of a model like a patient-centered medical home, PCMH, but also its alignment with existing quality improvement mandates and the potential impact on patient outcomes and resource utilization, all within the specified regulatory context. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the PCMH model's suitability. This involves a thorough assessment of its alignment with established quality metrics, patient safety standards, and the regulatory requirements for healthcare delivery. By focusing on data-driven decision-making, stakeholder engagement, and a phased implementation strategy, this approach ensures that the adoption of the PCMH model is not only strategically sound, but also compliant with all applicable regulations and ethical considerations, ultimately leading to improved patient care and organizational efficiency. An incorrect approach that focuses solely on the potential cost savings of a PCMH model, without a comprehensive evaluation of its impact on quality of care or regulatory adherence, would be professionally unacceptable. This failure stems from a disregard for the core principles of healthcare quality, which mandate that cost-effectiveness should not compromise patient safety or the delivery of high-quality services. Such an approach could lead to regulatory noncompliance, patient dissatisfaction, and ultimately, poorer health outcomes, violating ethical obligations to prioritize patient well-being. Another incorrect approach that involves adopting a PCMH model based on anecdotal evidence or industry trends, without a rigorous assessment of its fit within the organization's specific patient population and existing infrastructure, would also be professionally unacceptable. This demonstrates a lack of due diligence and a failure to apply sound quality improvement methodologies. It risks implementing a model that is not sustainable, does not meet the needs of the target patient group, and may not achieve the desired quality improvements, potentially leading to wasted resources and a failure to meet regulatory expectations for effective care delivery. Professionals should employ a decision-making framework that begins with clearly defining the problem or opportunity, followed by gathering relevant data and evidence. This includes understanding the regulatory landscape, best practices, and potential impacts on all stakeholders. Next, they should identify and evaluate potential solutions or approaches, weighing their pros and cons against established criteria, including regulatory compliance, quality impact, feasibility, and ethical considerations. Finally, they should select the most appropriate approach, develop an implementation plan, and establish mechanisms for ongoing monitoring and evaluation to ensure desired outcomes are achieved and maintained. Question 20. Implementation of a new quality improvement initiative requires the integration of external benchmarking data to identify best practices. A healthcare organization has received a comprehensive report detailing performance metrics from peer institutions across several key quality indicators. The organization's quality team is tasked with determining the most appropriate next steps for leveraging this data to enhance patient care and operational efficiency. Option A. Immediately implement changes to align with the highest performing benchmark metrics across all identified quality indicators, assuming these represent universally superior practices. Option B. Disregard the benchmarking data entirely due to minor variations in data collection methodologies compared to the organization's internal processes, deeming it not directly comparable. Option C. Utilize the benchmarking data solely to highlight areas where the organization is underperforming, without initiating any further investigation or planning for corrective actions. Option D. Conduct a thorough internal review of the benchmarking data, validating its methodology and relevance to the organization's specific patient population and service lines, before identifying actionable areas for improvement and developing targeted interventions. The correct answer is D. Conduct a thorough internal review of the benchmarking data, validating its methodology and relevance to the organization's specific patient population and service lines, before identifying actionable areas for improvement and developing targeted interventions. Explanation. This scenario presents a common challenge in healthcare quality improvement, effectively leveraging external data for internal process enhancement. The professional challenge lies in discerning the most appropriate and compliant method for integrating benchmarking data into an organization's quality strategy, ensuring that the chosen approach aligns with regulatory expectations for data integrity, patient safety, and continuous improvement, without introducing undue risk or misinterpretation. Careful judgment is required to balance the desire for rapid improvement with the need for rigorous validation and ethical data handling. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based integration of benchmarking data. This involves a thorough review of the data's source, methodology, and relevance to the organization's specific patient population and service lines. By validating the data and understanding its context, the organization can identify meaningful areas for improvement that are directly applicable and actionable. This aligns with regulatory frameworks that emphasize data-driven decision-making, patient safety, and the pursuit of evidence-based quality improvements. It fosters a culture of continuous learning and improvement by ensuring that changes are based on reliable insights rather than assumptions. An incorrect approach that involves immediately implementing changes based solely on the highest performing benchmark, without internal validation, fails to meet regulatory expectations for due diligence and evidence-based practice. This could lead to the adoption of practices that are not suitable for the organization's specific context, potentially compromising patient care or resource allocation. It also risks misinterpreting the benchmark data, which may have been collected under different circumstances or with different patient populations. Another incorrect approach, which is to disregard the benchmarking data entirely due to minor discrepancies in methodology, represents a failure to engage with valuable external insights. While critical evaluation is necessary, outright dismissal, without attempting to understand or reconcile differences, can hinder progress and prevent the organization from learning from leading practices. This can be seen as a missed opportunity for improvement and may not align with the spirit of continuous quality enhancement expected by regulatory bodies. A third incorrect approach, which is to use the benchmarking data to solely identify areas where the organization is underperforming without a plan for investigation or improvement, is also professionally unsound. While identifying gaps is the first step, a lack of subsequent action or analysis renders the benchmarking effort unproductive and potentially demoralizing. Regulatory frameworks expect organizations to not only identify quality issues, but also to implement strategies to address them. The professional decision-making process for similar situations should involve a structured approach. 1. Data acquisition and initial review. Obtain benchmarking data and conduct a preliminary assessment of its relevance and potential applicability. 2. Contextualization and validation. Critically evaluate the benchmark data's methodology, data sources, and patient population characteristics. Compare these to the organization's own data and context. 3. Gap analysis and root cause exploration. Identify significant discrepancies between the organization's performance and the benchmark. Investigate the underlying reasons for these differences. 4. Action planning and implementation. Develop evidence-based strategies to address identified gaps, prioritizing those with the greatest potential impact on patient outcomes and safety. 5. Monitoring and evaluation. Continuously monitor the impact of implemented changes and reevaluate the organization's performance against benchmarks and internal targets. 6. Ethical considerations. Ensure all data handling and decision-making processes adhere to ethical principles and regulatory requirements regarding patient privacy and data integrity.